go. So hello everybody. So welcome to our very first webinar between NCFE and Sim & Skills, and this kind of launching this brand new partnership that we have between NCFE and Sim & Skills, and I'm very excited about what's to come between us. So today is really exploring tackling year 2, how to support, teach and assess your T-level health students to achieve the best outcomes. So for those that I haven't met yet, which I think I have now met quite a lot of you probably that are on this call, but I'm the Provider Development Officer at NCFE, and my role is to support all the health and science providers for the T-levels. That's it. That's all I focus on, is just health and science T-levels here at NCFE. And I support on that one-to-one teaching and delivery support through CPD events like this, face-to-face, resources, bite-sized recordings, and so on, which I will share at the end of this call how you can access all that support. So a little bit about our new Sim & Skills partnership. So the whole point of this was to really start bringing it to life, sort of this active learning through those skills. We've done lots of CPD now, which is preparing for assessment, teaching, resources, but actually there was a real gap in this support, which Nicola and our team are really there to help support and fill, where we really support in that skills side of it, which is super important for the T-level health. And it's really about enhancing your teaching expertise in relation to curriculum alignment and that practical application. So before we get started and with Nicola and team, what I want to do is just set out key reminders that are really important for this first term and to make sure that you are ready for year 2. First of all is making sure that you have accessed your standardisation training material. So that's for assignment 2 of the year 2 occupational specialism. They are available on your exam portal, so you should have registered your students now for their occupational specialisms, and your exam team can now download that standardisation training material pack for you to standardise for assignment 2. And also I want to just make sure that you are using the most up-to-date supporting healthcare tutor guidance as well. So that's on that in the support materials tab on the qual page, making sure it says October 24 at the bottom of it. This gets updated every year, and this is mainly to support on those assignment 2 practical activities where we tell you those practical areas that are going to be the focus of assignment 2 and give you that breakdown of which then skills and knowledge that then maps to. So 2 key things to be making sure that you are accessing them, and if you haven't, don't worry, at the end of this, put in the Q&A, put in the question, I don't think I've accessed this, and I can share the links as we go through today and make sure you're accessing and you've got the most up-to-date resources. So I'm now going to pass over now to Nicola and team, who is then going to move and take over this session for the rest of today. Thank you.
Thank you. Thank you very much, Tracy. Hi, everybody. I'm Nicola, and as Tracy said, I'm from Sim & Skills. So we are one of the leading providers of healthcare simulation and clinical skills training equipment. And we've been supporting T-level health providers for about 3 years now. We've helped hundreds of colleges get the equipment that they need. And we've done this through really focusing on equipment that is matched to your curriculum. So it is exactly what you need and it's going to benefit your teaching. So some of the things that we've done, we've created a T-level health product guide, which actually sets out equipment and then has aligned it and matched it to your curriculum. So you can go through there and you can see what things are available for you specifically for your course and your teaching. If you've signed up to our website before, you'll already have a copy of that. We update it quite regularly and we have a new version coming out in the new year. But if you haven't got a copy, if you visit our website, simandskills.co.uk, and click on the T-level button, there's a little sign up thing to be able to sign up for our product guide there. But one of the other things that we've been doing to help T-level health teachers is webinars. So we've done some webinars in the past, and as Tracy said, this is the first in a series of webinars that we're going to be doing with the NCFE. I myself am a former teacher, and I know from my teaching days that when you're faced with a brand new curriculum and all the challenges that comes with that, one of the best things that you can do is to listen to and learn from other teachers. Teaching teachers is one of the best ways to learn and get that support that you need. And that's why we're really, really pleased to be able to work with Leeds City College. Vicky from Leeds City College is with us on the call today and will be available to answer questions later on. Leeds are one of the original Wave 1 providers, so they're into their 4th year of teaching the course, and with my very, very simple maths, I can work out that that means they've done 2 years worth of year 2, and they're now onto their 3rd year of teaching year 2. So in today's session, we're going to take a tour of their learning environment, see their health suite, science lab, and the setup and how they operate there. But we're also going to get the opportunity to listen to them and listen to their experiences of teaching year 2, going through the assessment process, all the logistical challenges, and probably very similar things and headaches that you yourself are going through as well. And the final bit of our session today, we're going to have an introduction to some of the equipment that we recommend to colleges that we work with my colleague Dan, who's going to go through some of the things that we think will really benefit and help with your teaching. So as you said, the Q&A function is available. If anything pops up during the tour or the interview or the demonstration, please pop your question in the chat. We'll try and get to as many questions as we possibly can at the end of this session. So first, we're going to then go on a tour of Leeds City College. So thank you to Vicky, Celia and Finley, who are on the tour, for taking us around, and we're going to hear from them now.
Hi, I'm Vicky. I'm the Deputy Head here at Leeds City College for the Health and Social Care Department. And yeah, we're a very big department. We've got just short of 1,000 students all studying health and social care of different levels and of different ages. So welcome, and we'll take you on our T-level journey.
Hi, welcome to our practical care suite. Come on in. So this is our practical care suite, and it's set up in a clinical way, although it's I've just moved some things out to show you what we've got in here equipment wise. We have 2 beds, both fully functional hospital beds, and we have a fully working hoist. So our students in year 2 use this mainly because we use it for the clinical skills that they learn with the occupational specialism that we offer, which is supporting the adult nursing team. So we have a mannequin, which is a responsive mannequin, and with this we can get the mannequin to say yes, no for consent. We can make the mannequin kind of vomit, not literally, but make the noise of somebody vomiting, coughing, kind of groans of pain. And we can also set up a digital display for certain physiological measurements and patterns for our students to work with in a scenario thing to respond and kind of identify things of concern. So we do use the mannequins. Often we move the mannequin into the weighing chair over there because we do have our students actually lying on the beds for things like moving and handling, and for kind of personal care and practicing those clinical skills. So just a week ago or 2 weeks ago, we had both our year 2 groups did basic manual training and manual handling, and they were using the hoist. Everybody had a turn in the hoist. They were using slide sheets and learning how to move somebody from lying to sitting in a bed, and getting someone on and off the bed. Last year in assessment 2 for the year 2 students, there was a scenario which asked the students to move somebody to a TV chair with the use of a wheelchair, which was the manual handling scenario. So we will be having further training on top of the basic manual handling training to make sure that students know how to operate and use the wheelchair safely, and move a patient from a bed to a chair in the correct technique. When our students are in this room, we ask them to wear their tunics. This is a male tunic. So we have the tunics, all of them have a tunic and it says T-level student on it. So when they're in here doing their clinical skills, in their practical, they are professionals. They're all in their tunics, as is Yvonne, who is our trained nurse who delivers the clinical skills practical sessions. So it's a very professional standards, expectation-wise. And we also set up the assessment 2 scenarios in here for the most part, but we also have an adjoining classroom, which is also a space where we would conduct some of the scenarios for the assessment. When we are doing these assessment and clinical skills, all of the toilet sinks in here are all fully functional. So hand washing is something that the kids would do at the sink, and obviously they're videoed doing the correct techniques. As far as maintaining equipment in here, we have somebody who comes to kind of look at and maintain our responsive mannequin, and we also have people that come and maintain our hoist so that it's fully functioning for our practical lessons. In our classroom across here, students, obviously we have 2 beds. In an ideal world we would have more than 2 beds because we've now got a growing number of students, and obviously they're going to be working in smaller groups, so we would ideally like 3 or 4 beds so that they can work in groups of 4 or 5 when they are doing clinical skills. So that would be on our wish list, but obviously that's an expensive improvement, but with funding hopefully we might be able to have that. We have our adjoining classroom, so obviously we've got locked lockers there where we keep our supplies like boxes of gloves. We have plastic bowls in there, some of the aids for people to use like the grabbers, and also our perishable items like the latex gloves or the gloves and the pinnies, etc. So we have everything locked up, and we also have our physiological measurement equipment in our cupboard, so everything is to hand. So I'm looking at that. So all our cupboards are with equipment that's used as part of the clinical skills. Okay, so if I take you through to our classroom here, this is also timetabled at the same time as the practical care room, and in here students will do part of the lesson where they do things like care planning and case studies, and if they're doing clinical skills they will have a task to do and they'll do it in groups. So 2 groups will be in there, 2 groups will be doing a task in here, and then they rotate. So that's how we use the 2 rooms. Also over here we have an inspirational display, because we're now in our 4th year of delivering T-level health, and we have seen 2 year 2 groups go on to their next career pathway steps. This is just something where I've given some examples of their destinations. We had 15 students in this group and 15 students who left us in July this year. In year 2 we've got 30 students. So we have double the number of students who will be leaving us at the end of this year and moving on to their next destination. This year, surprisingly, there's a lot of people who want to do apprenticeships, and also a lot more who want to do paramedic science, as well as things like midwifery, nursing. So we've got quite a lot of different destinations. Nursing, mental health nursing, paramedic science, and also some apprenticeships the year before, medical engineering apprenticeship, for an example of somebody moved on to that the year before this last year. So we will hopefully have many more lines, obviously some longer lines, and probably some different destinations as well as apprenticeships increase and options become more varied. So that's just one thing, because both the year 1 and year 2 groups all use this classroom. So it's kind of a bit of an inspiration for those that have just started T-level to see what came before.
Of course, are you responsible for teaching here?
Okay, so the core B elements, which sets them up for their second year, before they then go on to their speciality, which is adult nursing that we teach here. I go through all of the 11 different body systems that they have, and all of the diseases and dysfunctions associated with them.
So what kind of things do they do? Are they doing practical things? Because we're in your lab at the moment. Are there practical as well as theoretical things that you're teaching?
Yeah. So once we've started the year teaching about the respiratory and the cardiovascular system, we then improve that knowledge by doing dissections. So we will dissect hearts and lungs, look at all the connective tissues, and we then go on a little bit further to look at digestion by looking at the liver. And it really helps them being able to look at the finer structures within these organs. One thing that they do, which adds a little extra element to it, is repairing a hole in the heart. So I actually get them to suture holes in the heart, and they quite enjoy that. Makes them feel like they're using some future technical skills. I know some of them I've already started thinking that they'd like to be maybe physician associates, or go into advanced nurse practicals type skills. So yeah, it's to get them to think a little bit further out of the box into different types of roles, not just in the course that they're doing now.
And what sorts of challenges do you face when you're teaching to this age range and with the very specialist area that you're looking at?
Well, the major hurdle they have is that they're nearly all 16 when they arrive here, and they're examined within 9 months, which really is a very complex exam, which is very comparable with an end of A level rather than end of AS level. So to be able to answer the type of applied science questions that they're faced with in the exam, they really struggle with that at a very young age, because they don't have that practical knowledge that they would have if they'd already been in the hospitals and in some of this knowledge put into practice.
Do you have space in your year 2 for research if it's needed?
There's physical space, not in my teaching, so I'm unable to take time out of my teaching timetable to do revision lessons with them, so I can only really do that online with them. Give them lots and lots of exam papers. I think I've got 7 exam papers, despite the fact actually we've only had really 1 year of the new specification, but I've pieced together 7 different exam papers for them, and that's quite difficult. Normally, when I've got GCSE or A level, I've got 25, 30 years to call upon to create bespoke exam papers for the students. Sadly, I don't have that.
But the college as a whole teaching T-level is quite experienced. You're now going into your 4th cohort coming through. What are kind of the main tips that you would give to any T-level teachers that are taking on the teaching of the core B science element?
Well, I think one reason why we are successful is that we have quite a wide range of skills amongst the team. And so we have people, maybe like myself, with school experience, and then we have nursing experience. We have people who have taught BTEC health and social care and physiology for many years. So we're drawing on lots of different types of skills, and we all pull together. We all share ideas. We meet regularly. We work as a very, very close team. That's really important, that people get together and then share. We're on lots of forums. We speak to other teachers around the country. We share ideas. Try not to get involved with the moaning that a lot of other people do on these forums. We try and keep it very constructive. Training has been really good. So I went off to Cambridge last year to the Wellcome Sanger Institute and gave myself a real boost to teach genetics. One of my colleagues went off to Kent last year. We've had colleagues who have gone to other places, to other colleges to see what they're doing. So I think share and be willing to expand your horizons.
How are you this afternoon? Good. Do you like another cup of tea? Okay. Welcome to Maureen's flat. This is a space which is set up for use with health and social care, all levels of our vocational courses, and it basically demonstrates the range of adapted equipment that people can use and gives people an idea of how to work with people with disabilities or extra needs. So this is Maureen's flat. And it's set up as if it's kind of a community care type setup. So all the levels, level 1, 2 and 3 of our health and social courses do use this space from time to time just to have some practical experience.
So thank you once again to Celia and to Vicky and to Finley for taking us on a tour of their learning environment with their health suite, their living space and their science lab as well. So now we're going to get to hear from Celia and Vicky along with their colleague Samantha, who are going to talk us through some of the challenges and some of the successes that they've had with teaching Year 2.
You're one of the most experienced colleges teaching T-level health. Can you take us talk through a little bit of the journey that you've had now you're going into your 4th year of teaching T-level health?
So the T-level journey began probably about a year prior to going live with students. The first thing we did, and I cannot advise strongly enough, is you must get your employers on board. You need your local employers on board. You need for them to understand and to accept T-levels. Now, for us here in Leeds, locally, we had to change the policy because historically, any learner under 18 were not able to enter clinical settings. So we went back. We were very fortunate with our local employers. So that's Leeds Healthcare Academy, Leeds City Council, Leeds York Partnership Trust and the community services. We all came together collaboratively and we agreed firstly what our students would be doing. So we have an MOU which still stands today, we expect. So what did our employers want from us? How would our students serve our employers? What would be useful? Because we're in strong competition with the 3 universities that offer nursing within the city. And, so it was basically coming together that year before. What did we want? We also work with another college, another sixth form college. So we were very much a united front for Leeds. So Leeds was very much on the map. And how do we want our future workforce to grow and develop? And this is where we start.
You're going into your 4th year of teaching T-level health. What are some of the really significant changes either that you've seen or that you've had to implement during that time?
So lots of changes. So as I said, we started in 2021. So we were coming out of COVID. So we were very much still in our bubbles. We were still trying to get students on board that were used to home learning. We had nervousness around employers because some of our private employers didn't want to take any students because we still had sort of the health to be sort of and the COVID guidelines that were still in place. So things that have happened, our journey has been colourful along the way. So these guys will be able to talk to you more about some of the local challenges. But I think so. One of the main things is when initially we had to have Core A, Core B sat in the same window as the ESP. This year we have been bold and we've moved it to the autumn. So it's in the student's second year, and that was to kind of build on confidence. And yeah, so these guys will be able to tell you more on the other reasons around it and teaching.
Just before we come on to the specifics of the 2-year group, can you tell us how large your cohort sizes are now and what they were when you first started?
So the initial year we had 30, we had 31 actually, 31, and we kept them right for the first year. However, due to issues with the curriculum, we dropped significantly those learners going into year 2, so we dropped to 19. So the dropout rate was quite high. So then our next cohort, we were extremely cautious and we ended up recruiting 16. We've just left us. We left with 15, didn't we? And then this year, our confidence has grown and more students have learned more about T-levels. Our placements are amazing. Our employers are great. We had 30. And this year we have, how much enough first year? 32? 33.
32 now.
32.
Dropped to girls, gone to a different.
Yeah. So we are growing. We're not as big as our other level 3 division, which has 145 on. So we are.
We've got 61 currently. Yeah.
Provided. Does that increasing cohort size pose its own problems for you?
Absolutely.
Indeed it does.
Yeah. So classroom based, we're absolutely fine. However, it will pose an issue with employers because our employers are stretched. They have to support learners from university because they are very near the end of the training. But more importantly, we were unable to increase our numbers due to the assessments. I don't think one of you guys want to talk about the assessment.
So for one of the main challenges that we face with the growing numbers is the windows that we have to sit the exams in. So because I primarily teach from year 1, for me it's the ESP. So because that's over 2 weeks, before when we've had 19 students, 15 students, that's had its own challenges, but it's been doable in those 2 weeks. And still coming towards the end of those 2 weeks, just getting finished and getting things uploaded. Whereas this time, we actually have double the numbers now. So we've gone through the planning stages and we've looked at how realistically we're going to get these all fit in, but also looking at their well-being as well and being able to make sure that it actually fits their needs. They've got a bit of a rest break in between. They've got a decent break overnight when they've had hours in a classroom and things like that, lots of pressures. And we've just about made it fit with a couple of hours to spare, which is obviously one of the biggest challenges. So we've done that with 30 students for the year 2 this time. But to think, obviously, we've got a couple of students going to be extra next year, but then obviously in the years to come, if we're to get more, that's going to be a really big challenge.
So one of the big decisions you've made this year then is to move your ESP assessment from year 1, the end of year 1 to autumn term year 2. Are they about to just go through that, and have you seen a big change in how you think the students are prepared for that?
Yeah, so so I've been teaching on the T level since wave 1, so that is a couple of years now. So, and when they get to the ESP, it doesn't matter how many times you kind of go through the projects and different tasks that they do, they still have this really, and it's to be expected, it's an exam, they're really nervous and things like that. Whereas this time, with the year 2, now that they've been out on placement for 6 weeks as well, they kind of have a bit more understanding about person-centered care. They're seeing it, they're doing it actually in practice and things like that, and they're seeing care plans and the meeting patients with different conditions. So just their general confidence and attitude towards the EFP is a little bit better, a bit stronger. But obviously we've not done the EFP yet, so obviously we can't really say we know what it's going to be like until we get the results back and things and their feedback as well. But they seem to be a lot more positive going into it in the autumn term.
So which of the occupational specialisms do you teach here at Leeds?
That one?
Yeah, we offer support in the adult nursing team, and we have a qualified nurse who teaches the clinical skills, and we have other people who are trainer for manual handling. So we've recently done a drop-down day as a way of actually making sure that all the year twos have had the up-to-date basic manual handling training using the hoist and the basic techniques. And that was also something which the placement providers actually felt, you know, we could do along with the care certificate. So in year one, towards the end of the year, we started to complete all 15 standards for the care certificate. So doing that again towards the end of term, we think that we'll probably do that gradually over the course of the year in year one, so that it's less of a workload at the end of the term when they're tired after the assessments. So we will do that differently this year. But we do provide some, you know, kind of training which prepares the replacement.
So how do you generally split the teaching across year one and year two? You said you've got a teacher teaching clinical skills and you've got manual handling. Do you have teachers teaching certain specialisms across 2 years?
Yeah, so in year one, we are quite small. There's myself, we've got Pam who's doing one of the units, Gemma doing another one, and then Finn, the science teacher. There's 4 of us that teach across all of the core A and core B units or elements. So quite a small team. So we've got 18 hours in like face-to-face classroom learning. So 11 of those are core A, 5 are core B science, and then we've got tutorial and EFP as well. So we've actually dedicated an hour a week in timetable now to build an EFP skills. Because although we can do that in lessons, it's quite nice to actually have an hour dedicated to where they're actually seeing these skills coming into like your presentation, your research and things like that. Like you actually see that this is why we're doing it for the assessment as well.
We also did a mock ESP at the end of the summer term for the year ones, and those that kind of completed it all found that very useful, didn't they?
Yeah.
To do a mock for the ESP, particularly the role play part.
Yeah, they're actually giving it a go in action. So we can sit there and tell them, we can show them videos from past students doing it, and they can sort of sit there and critique it and things like that. But actually being there doing it themselves, they're like, oh, actually, it's not as scary as we thought it was going to be, which hopefully will make them a bit more confident this time.
And getting used to performing in front of the camera
as well.
Yeah. And is that sort of one of the changes that you're teaching now that you've actually, because the course has been going for a lot longer, you've got more examples that you can share with the students, you can get that practice in before you get to the assessment time so they don't feel so daunted.
Definitely. I think that was actually quite a big challenge. Is in that first year we had nothing to show for the year before, and we'd actually not gone through it either. So we've got this idea in our head of what it's going to look like and what it's going to be like, but then until you've done it, you actually see how it all falls together. So then we can use that knowledge in the second year then. So now having different role plays that we can show, and then like even written examples of care plans and stuff, it's a huge makes a big difference to actually your teaching as well, so they can see what their work should look like.
In terms of your teaching, do you notice quite a big difference in what you teach and how you teach from year one to year two?
I would say it's more specific with regard to topics, so health and safety, and I think this and obviously all the scientific side of things and the treatments and the disorders of the body systems. And we focus on the anatomy and physiology and the application of what's learned in year two. So case studies and clinical skills and applying what legislation is appropriate to providing personal care or with specific ADLs and stuff like that, and also looking at the specific anatomy and physiology for clinical skills. So, for example, here's one I prepared earlier. This is a lesson that I taught last Friday on the oral cavity, and the students made their own oral cavity, and we talked through the different parts and areas of the oral cavity, and I ended up with a link to what was Yvonne's lesson then on the clinical skills of personal care and oral care, by giving them the NHS or oral cavity assessment tool. So they then went away with that, and then they went to Yvonne and they were doing the practical oral care. So it kind of dovetails, we try and get it to dovetail. So for skin integrity, I will teach, so they have 2 hours with me, and then they have 4 hours with Yvonne doing the practical. So I will talk about the legislation attached to, or the things, the considerations when taking physiological measurements with regard to data protection, confidentiality, when to escalate, reporting and recording, gaining consent, human rights, and so on. So I will teach that side of that particular clinical skill, and like I say, the anatomy and the physiology of the structure of the skin, and then they'll go to Yvonne and they'll talk about the stages of earth pressure sore, and how to prevent and treat. So yeah, it dovetails. We try and get it to dovetail.
Do you find that there is more focus on practical teaching in year 2 than there is in year 1?
Yeah, I would say it's information heavy in year 1, and I think that's the challenge, isn't it, particularly with the science.
I think we do some practical, because I feel like it's one of the things that the students want to do. They're really eager to get in here into practical care. So we do as much as we can. So for example, health and safety, we do the stages of a risk assessment. So we do the theory behind it, and the different stages and the different types of risks, and then we like block off a full 2-hour session where we'll have some students in the attached, like adjoining classroom here, doing like a bit of a report, like we give them a report or a risk assessment and they get to sort of work with that. And then the other group would be in here identifying risks, so there'll be staged risks in here. So that's like one practical we do. And then in managing information and data, we look at things like news charts, and then bringing in a little bit of physiological measurements, so taking blood pressures and whatnot, so on each other. So they're actually getting to practice, like being the health professional, taking the observations. So we don't do as much. They definitely do. They do it weekly in year 2, don't they? Whereas it's kind of every half term we try and do something. So for example, I know coming up in health and wellbeing and stuff in person-centered care, we look at like nutrition and food, and they might feed each other and have different case studies. So it might be someone that's got like a hearing impairment or a sight impairment, and feeding them and communicating and stuff like that. So we try to embed bits in year 1, but definitely not as strong as you do in year 2.
I think they find it more tiring in year 2 because they're in college and they're doing practical, and then they're on placement 2 days, and then they're doing practical again. And I think their energy levels, you can tell it's not as easy as coming in and sitting in a classroom, because they're here, there and everywhere. So I think it demands more resilience, doesn't it? Yeah. Which is a challenge for the students. I think that's a challenge for us to keep the resilience at the level it needs to be at.
And their placement starts, you can start 7 in the morning. So it's to reflect true working patterns. So they might be leaving their home at 5:30 in the morning, 6 to get to where they need to be, and then finishing. So the idea was that it reflects true working environment. What we did say though, on the early days, was the shift is to finish 9 o'clock at the latest. So not doing night shifts, and not till 10 because they're under 18. So they are absolutely shattered. And the timetable that they're in, they're sandwiched, so we haven't got anybody that can go rogue. So they're sort of in college on the Tuesday, and again on Friday, but they're on industry placement Wednesday, Thursday, and that is across the city. So that's every year whilst we run T-levels, that is the pattern. So all employers know the days to expect a student and
Yeah, and that's what was agreed very early on.
During the week, they also have 2 1-hour tutorials, during which Sam's prepared. Every week since September, we've done a different lesson in one of the tutorials in preparation for the ESP. So we've looked at each of the elements of the ESP each week in tutorial time, and then the other tutorial is obviously working with them on UCAS applications and next steps. So that's also planned into their timetable, and that's when we get to talk to them about, you know, how placements are going and how they're feeling, and, you know, kind of troubleshoot any issues.
Checking on their welfare. Because there's a lot for a young person to see on the wards. It can be fast, it can be noisy, it can be upsetting. So it's just making sure that,
And shocking. Yeah, some of the things that they probably weren't expecting to do. Last year, there was a real compliment for 2 of our students who left year 2, who were involved in the personal care of a relative of a member of staff here. And, you know, it was kind of recognised by somebody who was a family member who was a healthcare professional, and said that the standard was better than the actual people who were employed. So that was a real compliment and a real indicator of how much they learn on the placement, how valuable it is. And I sat in all of the professional discussions, which are the last part of the year 2 assessments, and it was very emotional to actually hear, you know, the students talking about their experience and their learning, and, you know, just their journey. It's amazing.
I think what we do as well in tutorials, so because we have like the 2 1-hour sessions, yes, at the minute, because we've got the ESP coming up, one is dedicated to sort of prepping them for their employer set project. But we also do navigate, which is like where they get to put a journal entry in for that week on placement, so 1 for each day. And we go through the theories like GIBS and whatever, and how to structure your reflections and things. And I just did like a bit of a drop in and looking at their reflections so far, and they're absolutely phenomenal. The detail they've gone into and of how they've used that structure. So advice for anybody who's sort of starting their second year is to get them into that good practice of reflecting, because that will hugely help with the assessment rate when they come to having to use the journal to help them, because that's the only thing they can use. Like it's so much more support for them. They don't have to think back or try and do all that work in that 40 minutes prep time. It's done for them.
Like an EPA.
Yeah, it's really good.
So would you say that that's obviously one of the assessments at the end of year 2 is having that reflective piece? Is it important to try and weave through as many of the skills as possible throughout the year in year 2, so when you get to the assessment period, the students feel ready to take on their?
Yeah, we had a plan because obviously last year was my first year, and I had to familiarise myself, and also other members that were involved with year 2 hadn't actually gone through the assessment process. So it was kind of a learning and a training kind of group effort, where we all now feel very confident in the year 2 assessments, and also the assessment of it, and the moderation of it, because we had to go through all that and do all of this kind of standardisation and the moderation, and felt very, very pleased with the outcome from that. But it was a lot of hard work to get to understand the nature of it, you know, and the amount of time it takes is unbelievable. It's literally a full-time job, you know, kind of just going through each of the assessments. The students, obviously it was our first time, and I think I was trying to get the students to understand what to expect, because there's a high level of anxiety, and I think we got good feedback about the preparation that we did. For each of the assessments, we would kind of do some preparation So for assessment 1 was the 4.5-hour 4-task assessment, and we went through each task in lessons in preparation, so they understood what was required. And I think the only feedback they felt that, and they all performed well in task 1, so the outcomes were good for task 1 for all students. And they said that probably if they were to even better it, they could actually have a full mock and actually go through the 4.5-hour timed, and that was something that they said that would be even better to top off our preparation for assessment 1. For assessment 2, we did a lot of scenarios. We let them view students who'd been in the year before, and with permission actual videos of them going through the scenarios in assessment 2, and that again, to see somebody doing it took out the anxiety, and they knew what to expect. They felt confident that they could do all of the things, and in fact actually started to even kind of be constructive criticism on how that video and that student could have done even better. So they even in that preparation, we put on classes during the Easter holiday for the second part of assessment 2, and we had a full turnout for the 2 sessions, so that went well. And they felt prepared for the sessions. And then the assessment 3 was the professional discussion, and again we kind of showed little clips of previous students' performances, and then they had a feel for what to expect, and I think that was what they really appreciated, and they didn't feel the nerves as much. So we didn't have anybody having a meltdown, and we didn't have anybody saying I can't do it, and no tears. So I think we did pretty well this year.
I think with the assessment 2 as well, I think one of the challenges we faced, you've got obviously some students that are going into hospital and they are daily doing physiological measurement, moving and handling, seeing skin integrity and things like that. Whereas you get some in the community that's like, well, I'm not doing half the things that they're doing. And there's that kind of panic where they start thinking, oh, I might be disadvantaged because I'm not doing this every single day. But we do lots, especially for reflections and stuff for the assessment 3. But when they do it in college, they are encouraged to do the reflections based on what they do here as well. It doesn't have to be on placement. So that's been quite useful. And then one of the things we looked at, we haven't actually done it yet, it was just something we talked about last year, was potentially setting up like a bit of a clinic in college, like a staff clinic, where you could do like a drop-in and have, your, like we complete like a news chart kind of style. So you do like your temperature, your blood pressure, and whatnot, just so they can get that practice in as well, just so that their techniques are strong and ready for the assessment. But again, we've not actually gone and done that yet, and planned it out or anything like that.
We don't have enough rooms.
It's still a possibility. Speaking of the challenges attached to all the year 1, that those that are based in a room for a period of time without any individual slots are easy to organise and timetable, but then the individual nature of a lot of the parts of the employer set project, and also assessment 2 and the professional discussion assessment 3 in year 2 demand individual slots of a certain length of time to provide each learner with their allocated amount of time, and that then becomes the challenge, because we also have everybody else attending their normal lessons. So the rooming and the staffing is
An absolute headache.
A real challenge. However, with growing numbers, this time round we've got 30 students instead of 15, and so we need double the number of rooms and double the number of staff. So what's happened this time is the other level 3 course we offer are out on placement. The year 2s are out on placement whilst the ESP, so it frees up some of the rooms and some of the staff, and that's the only way
We can do it.
we can do it. But then it's literally if anybody is off out of the
staff that we're having to use, then it becomes more taxing.
Would you say that logistics bit with the assessments and getting the students through the assessment process is one of the biggest headaches that you face?
Yeah,
Definitely.
definitely,
Definitely.
yeah. And with us, I mean, with sampling, for example, they do the sampling where they do it on the number of learners, and then they will have a sample size for depending on your student cohort numbers, but they don't do that the other way around. So if we had a 3-week window, because we've got 30 learners, it would actually be much more manageable. But the fact that we've got the same window as somebody who's got 4 learners, that makes it very, very challenging for us, because it leaves us very little time to meet the deadline for uploading 30 videos times 2 plus 30 USB sticks full of templates that students have completed all in one afternoon.
I mean, that's another issue. We wouldn't be able to offer more than one occupational specialism. So when we first started on our journey, we offered 3. We offered the adult nursing, mental health and therapies. However, we learned very quickly that the assessment windows are all identical. It's the same 2-week window. It's the same staff, same rooms, and we just physically couldn't support that growth, which is a shame, because our employers are saying we want homegrown talent pipeline, and we're not able to provide that. So we are just doing the adult nursing now. And the other thing to think about is your equipment that you need when you're doing your assessments. So yes, you need all your clinical experience, but you do need cameras, and you need laptops or computers that are not linked to the internet. So again, just another tip there. We don't have IT suites here, but we did purchase laptops.
So you've already said about how you've already had amazing feedback from people who are seeing your students in placements and how well they are doing. So is there anything or any moments that you're particularly proud of, that you feel that you've seen students come through and you've shown on the tour the wonderful careers and degrees they're going on to? Is there that 1 or 2 moments that make you think, wow, yeah, the teacher, this is something I'm really proud of?
I think for me as a manager, I think it's the collaborative working. So it's not just with the employers. In 2 weeks' time, we've got the parent-employer engagement. So we actually invite our employers to come and speak to the parents, and they all turn up. We've had 100%, I think, turnout on all the years we've been doing it. And that's really useful as well. So our expectations, what the employers' expectations are, and then we need the parents to support our learners to go out and on placement, and to not hinder, and be really supportive with that.
I think it helps the parents understand what the employers are offering with regard to the types of placement and where they might be, and what they'll get out of the placement. And then what happens then, the students then express an interest in the type of placement they're interested in, and then we have interviews. They write a letter of application and then an interview. So it's kind of like a employability kind of experience, which is good, and the parents are aware of all of those stages then.
So they need to be leaving the house at 6:30 if there's a reason, because it has to support their placement. And they've all been really supportive, I would say, and that is half your battle. You need your parents supporting these young people as well.
And also just to raise awareness as well of the fact that they're actually going into a working healthcare environment, and people are ill, people, there may be situations that are quite shocking for them, with regard to, people deteriorating, and maybe actually even coming across people that are passing away, and having that kind of laying it on the table and being transparent about possible experiences that their child might have.
Plus all the occupational health that's required. So that was a massive stumbling block for us, because who was going to pay for the occupational health? So as a college, FE college, we get the minimum amount. It's on like a University student, they get 9,200 and whatever pounds it is a year. We get whatever the student. So we again have had to negotiate with the employers, and they get their occupational health paid for. How long that will last, we don't know. And if we expand our cohort, who would fit Bill? So that's a massive challenge.
I think when you mentioned that, it's like, is there any really proud moments? I think for me as a tutor, who sometimes it's quite nice to have, you know, just 15 minutes at the start of your tutorial where it's just like, oh, tell me what you've done on placement, stuff like that. There's some students who say some things and you just think, you've never done that. And like, it's the quiet ones as well that, you know, you think that might struggle just to kind of put themselves out there and stuff. And we had one student about 2 weeks ago, and I was reading their journal inputs, and I could see that they've been working like in a residential home, and they've been doing like bingo, and then one of the days, one of the activities was dancing. And I just thought, there's no way on the planet that student got dancing, I can tell you that now. And then I spoke to her about it, and she was like, oh yeah, I was up and I was dancing, I was doing this, and one of the residents was like teaching me how to do this, and it's just like, it's really nice to actually see you've come out of your comfort zone, and like, how did you get there? Because you don't, it's not skills that you see demonstrated in lessons sometimes, which is, it's really nice to see actually you're comfortable in that environment, working with lots of different individuals, different needs, and you're able to sort of do that. So I think when you see that as well, that's a really like proud moment. Yeah, you do. Yeah, you just think you've come so far. Like they say to you, like, oh, I'll be different from when we first come. Like, yeah, you definitely are. Yeah. Yeah, you are.
At the end of the year 2, there's also an awards evening, which is really lovely. And obviously last summer was my first one, and everybody got, you know, they get dressed up, and then there's awards presented by the employers to students, and many of our students won awards for their performance on their placement. So that's a proud moment as well, isn't it? To see everybody and you know, kind of having been on that journey with them, and everybody supporting everyone else. So yeah, it's lovely, really lovely.
Which could say as well, like some of them end up with jobs after lined up. So some might be doing some of the TNAs that they've got through being there and they've been recommended for it, or some might then go working like clinical support working roles on the wards that they've been in, and things. So it's quite nice to see actually that they must have been doing such a good job that they want to keep them and want them back when they've finished. So
if we were to say any kind of like if we had a wish list to make this, what we've got so many, you know, lovely kind of things to say about the journey that you go on with our learners, it would be to make the assessments less stressful, to be more trusting that the core exams don't feel like they're encouraging students to demonstrate their knowledge and application of that knowledge in their exams rather than trip them up. And then, you know, us feeling that we've got to pick up the pieces of that shock that they have because they felt that the exam, you know, in many cases the exam questions weren't accessible or as accessible as they thought they were going to be. So that would be our wish list. Think carefully about the impact that has on the students and their levels of motivation to keep going, because that's the job and a half we've had since September and results day with a group of able students.
I suppose you could say with that as well, like the questions on there is what you give them that at the end of year 2, and probably they'll be able to have a much better shot at it than they would be able to at, you know, 9 months into year 1. It's a lot of application which they haven't had the chance yet to actually be, yes, they've done bits of practicals, but not enough for them to be able to fully apply, which is what I'm definitely changing that in my planning now. I'm trying to put a lot more application, a lot more case studies in, and getting them to look at, you know, bits of documentaries where you can see legislation in action and stuff like that, but they're still just learning the basic information. You're throwing so much at them. How do they retain that and apply it? There's not enough time for them to be able to pick everything up and then be able to apply it at the same time. So I think, yeah, some of those questions, they're good questions, but they're just not for where they are at in the T level at the moment.
Yeah. And my second wish, as far as assessments are concerned, is just the resources that the assessments demand and how difficult and challenging that is. And actually, it's quite stressful
And
for
expensive.
an organisation to find the resources needed for the learners to go through this. But it's also actually stressful for the learners, and maybe to think about how they could break up those assessments across the year, and maybe it would be less stressful and less of a demand on the organisation and also on the learner themselves. So with regard to assessing clinical skills, surely they can break up the assessment of the clinical skills across the year, and actually do a practical assessment for individual clinical skills if that's what they want them to demonstrate, rather than leaving it to 7 scenarios across a space of 4 weeks, where one at a time has to happen. That's a really difficult way to assess, and very stressful for the learner themselves. Yeah.
So what would your top tips be to help students get through the year 2 assessments?
I think with them, obviously, when you come to an exam, you're really nervous and you forget your basics sometimes. They get so worked up and so anxious that the simplest things that they would remember on a day-to-day just goes out the head. So one of the things that we do is we obviously do lots of little sessions on the run up to them, reminding them of the basic things. But even things like we've created these booklets that like kind of give them basic things to think about. So we've looked at assessment 2 here, all the practical the scenarios and skills that they do. And it's things like, for example, if they were to do moving and handling, health and safety, have they considered that? So things like, is the area secure? Are there any hazards that need removing? So it's the basic things for them just to think about before they go in. Communication, have you introduced yourself? Have you asked for consent? Checking in with your patient during the moving and handling. Are they comfortable? Is there anything that they feel they need from you to feel more secure and safe? Person-centered care, what level of support, not just assuming that they need you fully. Because they're nervous, they're just wanting to show off everything they've got, and they're probably doing things that's actually not right for the patient. So it's just things like that. So we've created these little books to take away where they can use it as a revision resource on the run up to it. Obviously, they don't know until they come in that day, but it's just the key things. So health and safety, communication, infection control, person-centered care, the techniques, what they've been taught in sessions and stuff, really, just so they don't forget on the day.
And they do.
Which they will do still, but again, it's just those reminders that, you know, don't forget your basics.
So thank you so much for those fantastic insights that we have shared so far. I think really great conversations that we're having in the chat in here that Vicky and her team have really managed to highlight. We've had some really good questions in the chat as well, which people have been sort of answering back and forth and about sharing resources where we can. I've got a question for Vicky and their team. You know, the booklets that you shared at the end, are they linked to the practical areas that come out every September and October so that they're very focused for that assignment too? Or are they just more that general sort of underpinning sort of personal centered care and so on?
So they are actually more general, because what we found was some of the learners they were forgetting things, really simple things like washing their hands, which they would do all the time. I think the nerve just got the better of them, and it was just those key kind of points to get them just to get them focused, to remember, don't forget to do this. So
yeah,
but the team are pretty good. They do well. Obviously we can't release, because they're exams, we can't release, so they are very general, but they do try and keep up to date and try and make them as relevant as possible.
Yeah, fabulous. Thank you, Vicky. So just for those that are watching the recording back and can't see sort of the questions that I've highlighted, I just want to take this opportunity to share that before we moved on to our next video. So so one of the questions we had, it was around, you know, in regards to the manual handling, do you have outside organisation that comes in, or is it something that you do internally? And Vicky and our team shared very much that you've got trained assessors. Is that correct? That sort of complete this?
Yeah, we have our assessors who go out and visit our students on industry placement. So we actually paid for them to be the trainers. And we've got two assessors that do that. We also utilize our employers. But yeah, this is a request from what our local employers wanted. They wanted students to be ready to help move and handle safely.
Fabulous, thank you. The other one's around vaccines, because that was obviously introduced over the last year, and obviously you pointed out that your trust is working very well with you in regards to supporting that cost at this time. But I just wanted to share other providers' sort of experiences, that it's something that they've had to get their students to self-fund, but it's something that they've put very much at the beginning of the very beginning of the course. So, you know, this is a new requirement for them to be able to get in placement, and some providers have had to sort of self-fund it. What sort of discussions did you have with the NHS around supporting that funding, or was it something they were very proactive about?
Well, you have to remember we were at the time of COVID, so at that first time everyone had to be COVID vaccinated. It then came out, well, who's going to pick the bill up, and we did look into it ourselves, and the cheapest I think we managed to get was £350 per learner, which just is not doable for us, even though we're a big centre with all the DBSs and everything else that we pay. And then they've decided for now, and it's always up for renewal each year, that as this is the future pipeline, they are willing to invest at this stage and then do that. But that's not to say, who knows, it could change by this time next year. And then we might have to look at getting students to self-fund.
Yeah, fabulous. Thank you. And then obviously we had oh, where is it gone? I've just gone past it. We've obviously had a lot of discussion today around that occupational specialism meeting the sort of ESP window and having that overlap. And I wanted to highlight for the providers that IFE approved us increasing the ESP window, not until summer 26, but we have been able to, from summer series onwards, it is a 3-week window now for the employer set project. Well, just short of, because I think the first one's a bank holiday Monday. So 1 day short of 3 weeks is the ESP window, and that is to help support that overlap between the ESP and OS. And that's because of feedback from people like Vicky and her team who share that and continue to share like this, and through our feedback that we send is how we're able to sort of go to IFE and work with IFE in partnerships to go, this is what our providers need. So I think insights that Vicky is sharing voice what providers share with us, and it's something that we can be proactive about when we get that voice as well. So thank you for highlighting that, because I think it's nice not everybody looks 2 years ahead at the assessment windows, and it's just to let you know that as people start to get bigger, their classes, that is something that we've managed to get approved. So hopefully that will help you, even if you are keep it uncoupled, Vicky, having 3 weeks in the autumn as well rather than just 2 weeks might help support that as well. Let me see if any new questions have you got that have come in since we started. Grace asked, would you be willing to share these booklets? I don't know if those are copyrighted to your centre. If it's something that you're happy to share, I can always send it in a follow-up email. What would you say, Vicky?
I think the person that wrote it has actually got it on TES and would like to make a little bit of revenue from it. Fabulous. But I will certainly ask that question, which should be willing.
Brilliant. Thank you very much. And then how do you get your around funding the students' travel to placement? Our college is saying that they will only pay for the bus travel, but this means that the students can only make it cannot make it until 9 AM.
Okay, so most of our learners do qualify for bursary. Those that don't often self-fund, and also if they are free school meals, we'll provide vouchers on the 2 days whilst they're on industry placement.
Okay,
as well.
Thank you. And I think, Martine, I think that probably covers your question as well around that. I'm Just let me check. There's one more just to pick up. Right, I think we'll pick up some more questions in a bit, Vicky, for you and your team. What we're going to do now is we're going to move on to our final video. Nicola unfortunately has lost internet, and I'll pick up any questions in the chat as well that I haven't. Ideally, it'd be good if your questions were in the Q&A, because chat, as you know, on Teams, it just sort of disappears as soon as 3 people put their post, but I'm able to track it better in Q&A so I don't miss them. So I'm going to play a video now from Sim & Skills around sort of their resources that they have available to support as well. Let me just close this and play.
Thank you to Leeds City College for that really valuable insight into how they've been running their courses. My name's Dan, I'm part of the sales team here at Sim & Skills, and today what we're going to do is take you through some of the amazing and essential pieces of equipment that we think is really going to help your second years prepare for not only their clinical placements, but also their end of year exams. Okay, so now what we're going to do is just go through some of the essential pieces of equipment that I was just referring to. So first of all, we have here is our hospital bed, which is completely realistic as to what it would be in the clinical setting. So being able to have your students manipulate this bed through the motor gets them really ready to how they might be mobilizing and moving patients with moving and handling, and also, you know, really keeping that patient-centered care and communication to whilst they're moving. We also have our wheelchairs down here, so if you are practicing moving and handling with, say, a hoist that we also can supply, they're able to move those patients to get them comfortably and safely into the different positions. We also have things like our drip stand with our IV bags to simulate people that are having fluids and things like that, to make sure that your students understand what they are and make sure that they're using them safely and appropriately. We also have our fantastic head walls, which can really enhance and immerse your students into the clinical environment to make it feel as though when they are with you guys doing their simulation, to make it really feel as though they are in a hospital or a clinical environment, just to make sure that they understand and use each part of it correctly, and so they can see what others are using. We also have these fantastic pieces of equipment like this, our crash trolley, that goes through and is full of all different simulated drugs and different areas of the clinical area that they would need to use. We can go through and we can use this fantastic hand hygiene model to go through and make sure that your students really understand the importance of hand hygiene while they're not only in the college, but while they're out in the community and in the clinical environment as well. Moving on, we have Juno, who's sat in our bed here with one of our fantastic face masks to really enhance the fidelity and realism of the students as they're going through all of the different environments. What we can do with Juno, I'll just give you a very quick overview, is things such as eye care. You are able to give eye baths and put fluids back through the eyes. With things like Juno as well, you can put different NG tubes and different airway adjuncts in there, so your students are able to see what it looks like and the care around that. We're also able to do oral care and denture care, so you can take out the bottom set of teeth and practice doing that, and then they just slide back in with magnets to sit there. Moving down, Juno is also able to help with practical assessments in the way that we're able to palpate pulses, so we can take our heart rate, we can do manual blood pressures as well, so that your students can practice that over and over again. We're also able to change that, so we can have normal blood pressures, high, low, whatever it is that you guys are trying to simulate, you can do that as well. So as we know, one of the most difficult areas for the students to practice is in their communication skills. So it can be really difficult with any mannequin if they're doing it with peers in their classes, or even if they're doing it with yourselves as the teachers, as it doesn't quite give them that realism that they're looking for. They don't quite engage as much as they need to when they're going out into the clinical environment. So what we found is a piece of generative AI communication software called Simbox, and what that allows them to do is practice those really soft skills, having those everyday conversations that they're going to have when they're out in the clinical environment. So it allows them to talk to patients, and they can create their own scenarios, which you guys would like to. Really, really easy. You can even put in past paper scenarios, and they can just talk to them like that. So what I'll do now is I'll just have a quick demonstration and show you what it's about. Good morning, how are you today?
Good morning. I'm in a lot of pain, so not great.
Okay, can you tell me your full name and date of birth?
Kian Feeney, 11th April 1980.
Do you have any allergies I need to know about?
I'm allergic to pineapple.
Okay, can you describe the pain you're having?
It's a sharp pain in my lower back that's been getting worse.
On a scale of 1 to 10, how bad is the pain?
It's a 10. It's the worst pain I've ever had.
And are you taking any pain relief currently?
I've been taking ibuprofen and paracetamol for the last 4 days.
Perfect. And so as you can see from that little scenario that we've just run through there, it allows your students to practice things like person-centered care, making sure they're putting this patient at the center of what's going on and making sure that they're the most important thing. It also allows them to take things like consent and to check that the patient has capacity to talk to you about what's going to be happening in the next, few minutes of that clinical scenario. So at the end of the year, we know that the students have their assignments, and no matter what specialty that you're teaching, we know that there's going to be 2 main areas that are going to be within the assignment. We've got physiological measurements, and then we have skin integrity. So looking at some of this equipment that's here on the table, we have different physiological assessment pieces of equipment, so you can go through and the students are able to place O2 sats monitors on each other to practice. We have in-ear thermometers, we have forehead thermometers, and then we also have simulated pieces of equipment. So for example, this arm here, you're able to palpate a pulse. You can hear cough cough sounds, and you can pump up and take a manual blood pressure. Now this allows the students to do this over and over and over again so that they are really, really comfortable. So by the time it comes to the end of the year, to their actual assignment, they're completely comfortable, they know how it works, and they can go through it purely focusing on the task at hand. So having this equipment also allows the students to go through that frontline calibration, so they're able to take it apart, make sure that everything is working properly, calibrate it, and use it. So moving on to our skin integrity part of the equipment that we have on this table over here, we know that the students need to be able to assist in the assessment of care and treatment of skin integrity. So we have different pieces of equipment over here called sticky wounds, which can be applied to peers, people, or mannequins. So we have different abnormalities and different skin conditions like psoriasis, things like eczema, burns and abrasions, and also pressure sores, and we have different stages so they're able to identify the start and maybe later stages as well. We also have conditions such as pitting edema, and you can see on these models that we have here, they're really nicely because individually the students are able to see and simulate the different stages of things like a pressure sore. So we have just starting, getting slightly worse, and as the patient starts to deteriorate, they can go through and simulate what they would do in that scenario. So one of the last things that you need to consider when thinking about the end of year 2 assignments is audio-visual equipment. We know it can be really difficult to record with tablets, phones, webcams. So we provide mobile and fixed AV units. And so what that means is you can have several cameras in a room. You can use it all year round, really easy to set up so your students get used to being recorded. So they're not only being recorded in that final exam, so the nerves really kick in. It also helps with them when they're going through the reflective modules throughout the year as well. So they're able to debrief and look at exactly what's happened in every single scenario that they do throughout the year so that they can really reflect, improve, focus on that person-centered care and really improve on the dignity and all those soft skills as well. Thank you very much for watching. I really appreciate your time. If you'd like to know more information about any of the products that we have here today, please just visit our website, simonskills.co.uk. It's by no means an exhaustive list, and if you would like to see our T-level product guide, please let us know.
Okay, I'm not sure if Nicola has managed to get on. I did try unmuting her mic and everything, but Dan, you are on the call. We do have a couple of questions in the Q&A around the equipment. If there's any other questions for Dan and the team around sort of the resources side of it, please do feel free to put them in the Q&A. So, Dan, are you there?
Yeah, I'm here.
Yeah,
I'm here.
fabulous.
Sorry that you all had to suffer through listening to me talk there, but yeah,
No,
let me just go through some of these questions. To go through some ones. So the AI tool is called Simvox, so SIMVOX. If you guys want to have a quick look at that, you please by no means just go and have a quick look at our website. Also, we're more than happy to set you all up with trials. So if you want to have a quick trial of that so you can see how much you guys would use it, first of all, that's absolutely fine as well. But yeah, so please do just reach out, any of our emails. So sales@simanskills.co.uk or .com, sorry. So yeah, that's fine, lovely. Is there a link? Yeah, what I'll do is I'll pop the link to any of those products that are on there into the chat now.
Oh, brilliant. Kieran's on it.
There we go. I knew he was in here somewhere.
Fabulous. Thank you, Kieran. Yeah, no problem. So please feel free to put a few more questions in. Dan, I'll give you a shout if any more questions come up. So we're just going to move on to the final part of today before we have a Q&A sort of session. I'll move on before Dan starts talking again since he was so embarrassed. Before we do, I think there was just this final slide here around getting access to that product guide. I think that Nicola mentioned at the very beginning of the call that gets updated every year. That also has like updates on our webinar and event. Am I getting that right, Dan? I think off the cuff there. When we follow up with these slides, you'll be able to access that link and go straight and have a little look at that as well. So from NCFE, just to highlight what I mentioned earlier, we continue to support not only through fantastic sessions like this, and I must say, I think this has been our great first partnership, Simmons Skills and NCFE webinar. I think it's been really, really interesting. I think Leeds City College has shown us some really exciting ideas and thought-provoking as well, ideas as well, and reflections. To continue to get this support, and I know some providers had very specific questions around assessment, so please feel free to reach out to me to book a one-to-one support call, which you are entitled to have 3 in your first 2 years of delivery, so please utilize those. Obviously, we also have monthly drop-in clinics, so kind of like this Q&A, but actually you get to use your voice as well, so you can ask those questions that you have. We have best practice networks upcoming, and this picture is a little out of date. We are definitely in November, guys. The snow is telling us it is November, but yes, just when you get the links, you'll be able to click on this link and go to all of our events that are coming up. Our next Simmons Skills event, which will be in term 2, to be confirmed the date on that, that will go on to this events page also. I have shared the YouTube channel so far where we put all our previous recordings, and this recording will go on there as well within, hopefully by the end of this week. And there's lots of highlights of where we can support through playlists, through events and webinars. And then also coming up in the spotlight from the 16th of December, we're also doing our professional development week, which I hope you can share. We're going to be looking at lots of different things. Yes, Grace, the drop-in clinics are for year 1 and year 2. Just drop into any of the drop-in clinics, doesn't matter where you are in delivery, absolutely drop in, ask questions. Not a problem. So just like Simmons Skills, we also are in partnership with Gatsby, who also create free resources to support you in your teaching and delivery, from videos to PowerPoints to activity sheets. So our first phase supported year 1 content. We're now working on our phase 2 content with Gatsby, which hopefully will launch just after Christmas at the as well, with our, which are also focusing on some year 2 topics as well as year 1 topics. And we're also in partnership with RCNI, and this is a form which you can follow this link and fill it out. And what they do is they will have a little chat with you around all the available resources they've got available for T-level, and look at a tailored package for you. Obviously this will be at a cost, but if anybody knows anything about RCNI, they have a huge vast wealth of resources. Yes, Elisa, when I'll send you this as a PDF, and you'll get all these links in my follow-up, not a problem. But yes, RCNI have a huge wealth of resources, which maybe not all needed for T-level. So what T-level have done in partnership with NCFE, they're allowing providers to reach out, fill out a form, and looking at a bespoke package for you to support you with resources of the delivery of the T-level. So for the final 4 minutes, I would like you to put any final questions in the chat, and we'll answer anything that we haven't been able to answer, hopefully. And if we run out of time, don't worry. As I say, please still reach out by email or drop-in clinics or any way, and we'll be able to support you in any questions. while you're putting through your last few questions and before we finish for today, I'd also, and I know Nicola and team and Vicky, they would love for you to share any feedback that you have on today's session. I'll also pop the link in the chat because this is our very first session together. I haven't got the link there. I'll also send the link in the follow-up. But if you've got your phone, just scan that QR code and give us some feedback, because I know all three of us would really appreciate it, your feedback on this session. But let me have a look. Is there any final questions from anyone? I can see lots of thank yous in the chat. So because that's going to get inundated by thank yous, I'm going to go to the Q&A for questions. Quick, would you be able to give us an overview of what East Station involves for Year 2 assessment, please? Monique, it changes year on year. The practical activity areas on the tutor guidance that I mentioned earlier does focus that down for you of possible skills and knowledge that will be assessed. Depends, because some of the areas have multiple skills and knowledge attached to them, so it'll be a combination of those. That will help you focus your formative assessment. If you need a chat understanding those practical activity areas and that tutor guidance in a bit more detail, please feel free to reach out to me either on a one-to-one between you and your centre or through the drop-in clinics as well. Sign up for those. I'm able to do that. Yeah, it is great to hear how others are approaching this, especially Leeds City College, who have lots of experience. They've been there since the very beginning. Let's see if there's any new posts. Is there any helper training for the marking of Year 2? So Emma, you have your standardisation training pack. That is your training for that. So it's kind of similar to what you've done with sort of previous vocational quals, where you get an actual activity pack and you're able to sort of review your marking and do a standardisation. It's always done on that most recent series as well. So the summer series that's just launched, that's what your standardisation pack is available on. And there's also now graded exemplars available for this summer series, just came out in the last few weeks. So if you didn't know that, have a look. It's got the graded examples from this summer series. Obviously it had last summer series on, but on our website we also now have this year's also. So that's 2 series worth of graded examples that are now available on our website to help support you. So we have done some training around how to use the banding criteria for like extended response questions. So we did some recently where we looked at that in a recent core exam webinar, which I have since done a recording of, which is now on my playlist. And there's also an extended response question, bite-sized recording, beg your pardon, which focuses on paper B actually more than anything as an example. But that's okay, it's the same rules that apply, and how to use the marking grids to effectively mark students' progress as well. So absolutely, we'll continue to work on more training that's coming up in term 2 and term 3 as well to support you for year 1 and year 2 delivery. So one final question, who we're going to pick from our final question, just to see before we close for today. Is there a list of equipment that you must have? Yes, there's a resources list at the end of the spec. I think it's like page 420 something, I think, around about the 400 on. It's on the contents page. There's a whole equipment list of everything that you'll need for year 2, both to cover the skills sections in the spec, and then also you have then from that the practical activities will come from for the use of those equipment. So that's all in the specification, and they're a must. They're a requirement of running the T level, that you should have access to those equipments, both in class and for the actual assessment. So if you're having to borrow, for example, from a local uni, which some people do, or a local college, you can do, but you also need to make sure you can borrow them for the actual assessment as well. They need to be able to be available, because you don't know exactly what the task is going to be until 7 days prior, where you get the information prior. No problem, Suada. Right. So that is the end of today's session. I want to say thank you for Nicola and Dan and Simmons Skills. I think it's been a really great session, and I want a big round of applause to Leeds City College. Thank you, Vicky, and your team. You've been fantastic. I'm sure everybody found it really insightful and useful to hear from other providers. So thank you very much, everybody. Be safe getting home today for those that have a lot of snow.